All right, good morning. This is Mark Eberbach, and today we are going to, our video today is about assessing the 12 cranial nerves. Before we get started, we always want to make sure that we perform hand hygiene, wear gloves, and identify our patient, their name, and their birth date as well. All right, so the first two nerves that we're going to assess is number 5, the trigeminal, and number 7, the facial nerves. With the trigeminal nerve, we are assessing equal sensation on our face, and I'm going to be actually touching you with a cotton ball with your eyes closed, and you're just simply going to tell me, where am I touching on your face? And then for the facial, there's going to be two things I'm going to have you do. One, just puff out your cheeks, and 2, smile. And in that assessment, I'm actually going to assess motor function and symmetry of the muscles. So let's go ahead and start with the trigeminal, number 5. Go ahead and close your eyes and let me know where I'm touching.
My forehead,
Excellent.
my left cheek, right cheek, top forehead, my chin.
Excellent. So I've assessed that she's got good sensation, equal sensation through her cheeks, chin, and forehead. All right, now the next assessment is the facial. Let's start with just simply puffing out your cheeks. Excellent. Those are symmetry, that have symmetry, and you can go ahead and let the air out, and then go ahead and smile with your teeth. Excellent. So great. I've got symmetry in the smile and the puffing of the cheeks. The next cranial nerves that we're going to be doing, there are actually 3. It's to be number 6, the abducens, number 3, the oculomotor, and number 4, the trochlear cranial nerve. Each one will be assessing something different. All right, so the abducens, we're going to be assessing for lateral movement and movement of the eyes. So let's go ahead and do that one first. All right, so I want you to go ahead and stare at my pen, and we're just going to move it in an X and then a left to right. Keep your head still. Perfect. Excellent. So in that assessment, I'm looking at lateral movement left to right, as well as the eyes moving down to the right, down to the left, upper right. And you have smooth movement in the eyes, and that's what I'm really looking for, as opposed to some shaky eye movement. So the next cranial nerve is the number 3, ocular motor. What we're doing is we're assessing for light and making sure that the pupils will be equal round and reactive to light as well. When you're ready, you're going to go ahead and just look straight. Why don't we go ahead and look at the wall in the back. Excellent. And then your right eye. Very good. And in those situations, the eye did constrict to about a 3. I would say a 3 on that, and both eyes constricted well. All right, so the last one is the trochlear cranial nerve, and it's a one we're familiar with. Basically, I'm going to be moving the pen in from about 12 to 18 inches in towards your nose, and you just follow it, focusing on the top of this. Okay, are you ready?
Yeah.
Excellent. So in this particular assessment, we are watching the accommodation of the eyes and the convergence of the eyes, the muscles able to come in and then follow the item back out, as well as the focus of the pupils again, as they focus in on the item changing distance as well. All right, this is our next cranial nerve is cranial nerve number 2. It's the 2, and that is the optic nerve. And we're basically assessing her vision, the acuity test for vision. So Ariel, what I'm going to have you do is cover one eye. You're going to read the chart. I'd like you to read number 8, line number 8, with one eye. We'll switch eyes, you'll cover the other one, read from the left side, and then I'll have you read it with both eyes. So it's basically three tests, okay? All right, so let's go ahead and start with cover your right eye, and go ahead and read line number 8, please.
DEFPOTEC.
Great, all right, so go ahead and cover your left eye, and read it with your right, number 8.
DEFPOTEC.
Great. Wow, you have good vision. And go ahead and, better than mine, and go ahead and read it with both eyes open.
DEFPOTEC.
Awesome. So in this situation, number 8 is actually 20/20 vision. So your vision at 20 feet would be the same as an individual with normal vision at 20 feet as well. So all right, the next cranial nerve is cranial nerve number 8. It's the vestibulocochlear nerve, and it's basically assessing her hearing. So we're going to have, basically going to have you cover one ear. I'm going to whisper on the other side. You're going to let me know what I said, and then we'll switch ears, okay? So we'll go ahead and cover your right ear.
I heard 2K4.
Excellent. Go ahead and cover your other ear.
I think I'll have to go look for them. Oh, remember she did?
All right, and then go ahead.
I heard 3L8.
Excellent. So you heard all 6 numbers and letters. So you're okay. The next cranial nerve is cranial nerve number 1, olfactory. And what we're going to be assessing is smell or scent from her nose. So what I'm going to ask you to do is close your eyes. I'm going to go ahead and place an item underneath your nose. I want you to take a sniff and let me know what that smell is. Okay, if you're ready.
Is it peppermint?
It's not peppermint.
It smells like peppermint.
Does it? Okay, let's try one more time.
Is it hand sanitizer?
It is hand
Okay.
sanitizer. Excellent. So it took her 2 assessments, but she did get it the second time. Excellent. All right, so the next cranial nerves that we're going to be assessed, there's 3 of them. There's number 10, the vagus, number 9, the glossopharyngeal, and number 12, the hypoglossal. All 3 of these cranial nerves will be assessing sort of motor function of the throat, of the face, etc. So let's go ahead and start with number 10, the vagus. And in this simple test, we're basically going to have her test to swallow. I'm going to put my hand on the back of my hand on your throat. You just simply swallow. Okay. Go ahead and swallow. Excellent. So swallow's fine. Assessment is good. The nerves are intact. So, all right, the next one is number 9, the glossopharyngeal. And in this assessment, we've done this before in other assessments. It's pretty much straightforward. You open your mouth. I'll put a depressor in your tongue. I'm just going to have you say ah, and I'll be looking at the back of your throat. Okay. Go ahead and stick your tongue out, please. And say ah.
Ah.
Excellent. Thank you. And in that particular assessment, what I'm looking for is the uvula to raise and the palate also to move. And when she says ah, in that example was, again, a good assessment. All right, the last one in this particular one is the hypoglossal. And what we're testing is, I'm going to have you stick your tongue out here in just a moment. And then I'm going to have you move it back and forth and then as well as swallow. So, all right, go ahead and stick your tongue straight out. Excellent. And then move it to your right, to your left. And you can go ahead and put it back in. And go ahead and smile for me one more time. Excellent. And all 3 of these particular assessments here, we're looking at, we're looking at how well she can stick out her tongue. Tongue comes out straight, it's symmetric. She's able to move to her right and left, as well as smile. And there's symmetry in the smile as well as in the movement of your tongue. So, all right, our last nerve here is the nerve number 11, the cranial nerve number 11. It's the accessory nerve. Pretty straightforward assessment. Basically, I'm going to put my hands on either side of your shoulders, and you're just simply going to shrug and with a little resistance as I push down, and then you can let them back down, okay? All right, let's go ahead and do that. Go ahead and push up Excellent, and back down. Excellent. So pretty straightforward assessment. I can feel her trapezius muscles are functioning well. She lifted, there was resistance, and she able to push through that easily. So that concludes my my video today on the 12 cranial nerves. I'd like to thank Ariel and then my two resources, Taylor's clinical nursing skills, and then the Wisconsin Technical College for their sheet and their information on assessing the 12 cranial nerves. Thanks so much.